and thank you all for your patience. The National Housing Conference, we're thrilled to have the ability to bring together this kind of incredible intellectual capital that serves everything that we do. We really appreciate the work of our board member, Nan Roman, and Mary Tingerthal, and the incredible panel that she's put together. These issues are so desperately important for all of us to address. So many of you are involved in this every single day. I just want to thank all of you who are here for joining us, and just for everything you do on this just vitally important issue. We cannot never be a great nation while people are living in our streets. Luke, do you want to get us started?
Absolutely. Thank you, David. My name is Luke Villalobos, and I'm the Director of Policy and Research at the National Housing Conference. I want to welcome everyone for being here this afternoon. And we actually have a short video remark from U.S. Senator Padilla that we would like to play to open up this webinar.
Hi, I'm Senator Alex Padilla, and I have the honor of representing California in the United States Senate. Thank you for inviting me to open this conversation on the national need for affordable housing and the creative solutions that advocates are pioneering across the country. The National Housing Conference is a critical partner in the effort to provide affordable, safe, and supportive housing for people experiencing homelessness. Now, this past year has been challenging for so many. Because of the COVID-19 pandemic, many lost their housing, while others struggled to make rent for the first time. Others didn't know where to turn as shelters faced capacity limits and food banks saw overwhelming demand. These hardships were especially prevalent for those who had already been marginalized, including communities of color, low-income communities, and those with disabilities. I'm proud to have cast one of my first votes in the Senate for the American Rescue Plan, which sent $250 million in emergency housing vouchers to 73 California public housing agencies. Now, these vouchers provide essential, immediate support for people experiencing housing instability. The American Rescue Plan also included more than $600 million for the Home Investment Partnership Program in California, funding that I'm still pushing to increase. But that support is just the beginning. As we begin to recover from the pandemic, it's our job to rebuild a more inclusive and equitable world for all. A just recovery includes expanding affordable housing options to provide people with a sense of stability. It also means respecting the dignity and supporting the health of all community members. That's why I've worked with Senator Feinstein to introduce the Affordable Housing Redevelopment Act, which will authorize $1.5 billion to build more affordable housing. And building that housing will strengthen our neighborhoods, because in the process, we'll be rehabilitating and redeveloping properties that are old, vacant, or foreclosed. Creative solutions like these are a win for the entire community, because affordable housing is essential infrastructure. Every person deserves dignity, security, and a space of their own. I want to thank the National Housing Conference for their work to promote quality, affordable housing for all, and I look forward to the remarks of today's speakers.
Thank you. Is that back to me, Luke?
Yeah.
So I really appreciate everybody being here. And, most of our experience with homelessness has been incredible frustration trying to address the hardest issue of chronic homelessness. And we see in the point in time counts that there was pretty significant progress being made year over year until about 4 or 5 years ago. And then instead, what we see is this increasingly growing crisis of not just chronic homelessness, but economic homelessness. people who can simply no longer afford a place to live. And this is really a systemic failure of the entire housing infrastructure. We have to address that at its roots. We have to address the fact that people can't afford to own their own home, and so more of them are renting. We have to address the fact that people are unable to afford to rent their homes, so they're increasingly spending more and more of their income to survive. And ultimately, it is much easier for them to fall off the edge and end up homeless. I can't imagine how many thousands of people throughout Los Angeles and the Bay Area and many other cities in America. We've all seen this. People who are getting up in the morning, climbing out of their car or trailer or a tent, washing up in a bathroom and going to work every single day. That's just unacceptable. So there's a lot of work to be done in terms of long-term solutions. But in the meantime, we have an immediate crisis with the pandemic that clearly focused everyone on the need to respond creatively and immediately. And the use of hotels and motels to house people experiencing homelessness during the pandemic really offered a solution that proved to be both efficient and effective in responding to the needs of unhoused people. The pandemic allowed for an unprecedented investment of federal funds to convert projects to address homelessness. And it was incredibly successful in providing people who would have been left out on the streets. As you will hear about in this webinar, within months, not years, over 6,000 units were added to the housing stock in California from these initiatives. Other states saw success as well. There is a simple lesson here. Conversion projects work. Converting hotels and motels into permanent housing should be part of an overall housing strategy as we come out of the pandemic and continue to address homelessness as a pandemic of its own. These short-term strategies can be transformed into long-term solutions. We just need the funding and political will to get that done. Although when we say we just need funding and political will, I cringe myself. Projects like this don't only come from federal action. There must be local action. Each locality knows its issues better than anyone, and it will take public-private partnerships and local resources to bring housing to the areas where people need it most. Targeting deeply affordable housing starts at the local level through challenging restrictive zoning and utilizing state tools to fund projects. I will often say, you don't want your backyard to end up with homeless people living in your front yard. As we continue seeing plans and funding guidelines released in the next few months, look to innovative programs like motel conversions to help resolve our most pressing housing issues. When the funding is available, it can make real impacts for our most vulnerable populations. We need only to spend it wisely on proven solutions like what you're going to hear about today. Luke?
Thank you, David, and can't wait to get into the content. So without further ado, I'm going to introduce Mary Tingerthal, who's been an absolute pleasure to work with over the last month as we've been assembling this, the panelists and the content for this webinar. And she really has a great scope of what's happening around the nation with these hotel conversions, but you'll hear more about her work on that later on in the webinar. But Mary Tingerthal was the commissioner of the Minnesota Housing Finance Agency from 2011 to 2019. For the last 2 years, she's led the Tingerthal Group, which provides consulting services to public and private companies or organizations working to increase affordability of housing for affordable and moderate income families. Again, been great to work with you, Mary, and the floor is yours.
Thank you very much, Luke. And I really look forward to introducing this amazing panel. You're about to hear some incredible success stories and also learnings from the 3 states that are represented here today. I want to first introduce, I will introduce all of the speakers, and then you'll hear from them in order. First, Secretary Castro Ramirez serves as California's Secretary of Business, Consumer Services and Housing Agency. In that role, she oversees 10 departments responsible for expanding affordable housing, developing solutions for homelessness, guarding civil rights, regulating banking and financial services, and strengthening consumer protections. And I have to think that that broad portfolio was helpful in the amazing results of Project Homekey that you'll hear about. Along with Secretary Castro Ramirez, you'll hear from Rick Gentry, who serves as the president and CEO of the San Diego Housing Commission. Rick leads an agency with over 300 employees and an annual operating budget of $268 million, and really represents an anchor of housing for low-income people in Southern California. We then have Representative Pam Marsh. She represents the 5th District in the Oregon House of Representatives. She was reelected to a 3rd term in 2020 from her district in Southern Oregon, and currently serves as the chair of the House Energy and Environment Committee, and as the vice chair of the House Special Committee on Wildfire Recovery. And you'll hear more about why that role is so important. Megan Loeb serves as program officer for housing and economic vitality for the Oregon Community Foundation, which has been the agency responsible for delivering the Hotels to Housing program in Oregon. Prior to her role at the Community Foundation, Megan led corporate social responsibility initiatives for several technology companies for 2 decades. And then we'll wrap it up with a state across the country in Vermont that has been a real leader for years in hotel to housing conversion. Michael Monte serves as CEO of the Champlain Housing Trust in Vermont. He joined the leadership team at Champlain Housing Trust in December of 2007 and was just appointed CEO in January of this year. Michael was the founder of the Burlington Community Land Trust and was a board member for Lake Champlain Housing, and those 2 organizations merged to form Champlain Housing Trust. I do want to let you know that we will take questions from the audience, but only after the 3 presentations. So please, as questions come up on the specific presentations that you see, please enter them into the Q&A, and we have left a good chunk of time at the end of the webinar to handle your questions. So I do encourage you to use that Q&A box. And with that, I'm going to hand it off to Secretary Castro Ramirez. Thank you.
Thank you so much, Mary. Good morning, everyone. Give me 1 second because I lost the screen here. Okay, I'm back. I hope you can see me. I temporarily lost the screen. Well, Mary, thank you again to you and to the National Alliance for the invitation to be part of this conversation. As Mary mentioned, I'm Lourdes Castro Ramirez, and I serve as the Secretary of California's Business, Consumer Services and Housing Agency. And I'm delighted also to share this platform with a number of distinguished individuals, including my dear friend and colleague, Ann Hauser, the CEO of the San Diego Housing Commission, Rick Gentry. And so again, this is very much a conversation about how in the midst of this pandemic, our state, the state of California, was able to come together and to prioritize the importance of protecting and providing safe housing to people experiencing homelessness. We know that this model that led us to convert motels and hotels into permanent housing truly does work. And I'm excited to share with you how we've been able to make it happen. I am also excited to share with you that this is quickly becoming a national model. We've received numerous calls from states across the country. And as the senator mentioned, this is also an important piece of the American Rescue Plan, as we know that dollars are eligible, or this, dollars from ARPA can be used for eligible projects such as Homekey in the conversion of buildings into permanent housing for people experiencing homelessness. Yesterday, also, the Joint Center for Housing Solutions of Harvard released their annual housing report. And I was delighted to read that they also took note of this approach and strategy, calling it an effective response to a public health threat. So we recognized early on in the pandemic that people experiencing homelessness were especially at risk, not only of infection, but also of dying from COVID-19, given their lack of access to proper health care, proper services, and just overall underlying conditions. Next slide, please. Just as a way of background, even before the pandemic, the number of people that were experiencing homelessness across the country was on the rise. And this is, for a number of reasons, as we heard earlier, the increasing gap between wages and housing costs, rents that, have doubled, and also the lack of federal investment. According to HUD's point-in-time account, just, released a few months ago that reflects data from 2020, there was an increase of 13,000 people experiencing homelessness for a total count nationwide of 580,000. And we know that that increase was largely driven by unsheltered homelessness. In our state, where we have nearly 40 million people, the most recent estimates from HUD's point-in-time count show that we have just over 161,000 individuals who are experiencing homelessness on any given night. However, our state, through this agency and through our Homeless Coordinating and Financing Council, has been investing deeply in developing more robust data to better gauge and understand the scope of the homelessness response delivery system. And I share some additional data here with you that shows that in 2020, the homelessness response system across the state, which is comprised of about 44 continuums of care, were able to provide support and services to about 248,000 people. And you see the breakdown, 64% representing individuals, 34% representing families and children, and almost 10% representing unaccompanied youth. Next slide, please. So as a housing first state, we know that addressing issues of housing costs, housing stability, and homelessness is critical to creating opportunities for all Californians. And our response to homelessness, especially during this pandemic, was even more sort of laser focused, and not just sort of laser focused on addressing and providing protection against this public health crisis, but also we recognize that there are significant disparities when we look at the homelessness system, where there continues to be an overrepresentation of Black Californians, Latino Californians, Indigenous people. And so, very much mindful of how important it was for us to develop a set of responses that were aligned to protecting individuals, but also recognizing their racial and economic situation. So against all odds, and during this devastating pandemic, we created solutions to keep families housed and to create this approach. I do want to mention that it's very important for me to share with you that within the structure of the state's emergency response, we were very mindful that if without making this a priority and without having commitment from departments and agencies across the state, this was not going to enable us, right, to provide the level of response and assistance and protection to this population. So very early on, the governor and within the state's Emergency Operations Center developed the Housing and Homelessness Task Force, which was comprised of housing experts from within the state, health experts within the state, and emergency first responders. And I want to pause here because I think there's something to be said about the importance of recognizing that when we come together, when you have a cross-cutting, cross-collaborative approach to addressing homelessness, and when you get out of your comfort zone and bring your expertise, I think that from my perspective, this was critical in shaping not only our efforts, but also of ensuring that we were being comprehensive and acting with a sense of urgency. So this, task force led us to a number of innovative strategies and rapid, deployment of resources. We developed consistent guidance and technical assistance to homeless providers across the state. As we began looking at funding that was coming in from the federal government, but also funding that the legislature was assigning and allocating to individuals experiencing homelessness, we were constantly looking at ways to provide greater flexibility with use of state funding and federal funding. And frankly, I think this framework and structure led us to the development of two very innovative strategies. The first, next slide, please. Let me pause. The first, as I think many of you know, is Project Roomkey. And, Project Roomkey, very much a partnership between the state and local governments to secure hotels and motel rooms for people experiencing homelessness to avoid being exposed to COVID-19. The program was administered by our colleagues at the Department of Social Services, and it is a program that continues. It continues to provide safe interim housing. It has been a successful program that has provided interim housing for over 42,000 people across 42 counties. Much of the funding in support of this program was through FEMA reimbursement, through also federal CRF dollars, Corona Relief Fund dollars, local funding, and general fund funding. This was a life-saving option that propelled us and really led to the creation of Homekey. Next slide. So building on the success of Project Roomkey, the state created the Homekey initiative. Homekey enabled the state to make funding available to locals, to local cities, counties, housing authorities, and public entities to purchase hotels and motels, buildings and other housing types, and to convert them into interim and permanent housing for individuals experiencing homelessness. Thereby, really the focus was to increase the capacities of local communities to respond to the COVID-19 pandemic. The target population was individuals experiencing homelessness or at risk of being homeless. And the state, through our Housing and Community Development Department, was able to leverage $750 million in federal coronavirus relief funds plus 50 million that was appropriated by the state legislature, and 45 million in philanthropic dollars. So truly a public-private philanthropic partnership that enabled us to, in a very a very short amount of time, to be able to produce nearly 6,000 housing units, representing 94 awards across the state, 51 jurisdictions, which is essentially 51 counties that participated out of the 54 that the state currently has. And we have 120 unique sites. And as was mentioned, this was also a very effective and efficient strategy, not only in terms of the timing from the release of the first notice of funding availability, but also in terms of the cost. The average per unit cost was just under $130,000. And definitely when we look at the time frame that it took to get from July through December, this was a program that was successful. We came under budget and on time, and we could not have done this, of course, without the partnership and the collaboration with local communities. Was essential, but it also demonstrated, right, the capacity that local communities have to be able to make this happen. Next slide. And, of course, for us, it's very important, of course, to look at the people outcomes, at not only the total number of buildings and units that were created, but really understanding who we're serving. And so, this graphic that both, shows the total number of awards and total number of units also provides information on the individuals in the households that now, as a result of Homekey, have a place to call home. So we have close to 8,300 individuals that were either previously experiencing homelessness or at risk for becoming homeless who have been housed. Just over 1,200 seniors, 201 transition age youth, 333 minor children, and of the 94 projects, 24 of these projects are intended to house transition age young people between the ages of 18 to 24 who are at risk of experiencing homelessness. So again, very diverse portfolio, serving diverse populations. And I think this was again possible because we were very mindful of the importance of not meddling too much in the local priorities and their local the priorities that they have or had as it relates to the populations to be served. Our focus was ensuring the deployment of these resources and providing the level of technical assistance, to ensure the success of this overall program. Next slide. So just, a few points that I'd like to just make in terms of the overall design of the Homekey initiative here in the state. First, starting with equity and accessibility. I think we know, right, that prior to the to this pandemic, there were grave concerns about the inequities that we have seen across the housing spectrum, both racial and economic inequities. And it was clear to us that the pandemic only made the situation worse. And so as part of the application process for jurisdictions, we asked applicants to include a plan for how they intended to address these racial and economic inequities. And particularly in the state of California, where we have seen a disproportionate impact on Black and Latino communities. this was a very important priority for our state. The second piece that also builds on this foundation of equity was ensuring that there was a geographic distribution and frankly that there was an equitable opportunity for all jurisdictions, large and small across the state, to apply for Homekey funds. So we baked into the design geographic equity. We created 8 regions and allocated funds to these regions based on the proportionate share of persons experiencing homelessness. And this was both, sheltered and unsheltered. Again, a really important piece as folks consider the design or the opportunity to replicate this. Another really important piece was within the structure, within our housing and community development structure, we felt it was important to dedicate staffing resources, but also to develop a more sort of targeted technical assistance approach. So we created what we called consultations with all sort of applicants. There was one point of contact within the staff. We called them ambassadors. And these individuals stayed with the applicant from the beginning to the end and very much provided technical assistance, problem solving, and troubleshooting. And this is a programmatic innovation that we intend to retain as we look at scaling the Homekey initiative. The last piece that I will just mention from this slide is the importance of clearing the path to occupancy and addressing what oftentimes are these significant local barriers that don't allow these projects to move forward. So the Homekey, we again we needed to move at a rapid speed. We wanted to ensure its overall success. And so there was legislation that allowed Homekey awarded projects to have a clear path to receiving approvals and permits locally. Briefly, the law clarified that Homekey projects did not need to have local rezoning occur, that instead these projects were essentially automatically conforming with local land use plans, and this enabled these projects to move more quickly. We did have a couple of projects that fell through, but we were able to rapidly replace them because the pipeline, we basically had an oversubscription from locals for these dollars. And then lastly, on operating subsidy, the state committed $50 million to enable us to support operating subsidy and provide additional support to these to the administrators of Homekey. And we leveraged $46 million from philanthropic partners, including Kaiser Permanente, Blue Cross Blue Shield of California, and the Chan Zuckerberg Foundation. Next slide. And then just, briefly, in terms of the types of projects across the state in urban communities and tribal communities and rural communities, we have a very detailed report, Mary, that we can make available to the audience to provide more information. So we can go to the next slide. And, again, historic housing investment. This is a key strategy and should be a key component as we continue to holistically address homelessness. What we learned was the importance of a collaboration of integrating this model into our multi-pronged approach when we address homelessness. Housing and services is health, and we know that this program was effective in preventing and protecting individuals experiencing homelessness. And as I mentioned earlier, the program was able to provide support to very diverse populations. Next slide. And just, as I conclude here, the success of Homekey has garnered tremendous local support and tremendous, support up and down the state. The governor most recently introduced his budget proposal that includes $12.4 billion to address homelessness across the state. Of the $12.4 billion, $3.5 billion is proposed to scale Homekey, with $1 billion of the 3.5 going to addressing families with children experiencing homelessness. We know that there's capacity, we know that there's need, we know that this is a model that has been very effective. And we look forward to continuing to work with the legislature and to work with members of our local communities to continue to expand housing opportunities and services for individuals experiencing homelessness. The last point here that I just added was that the $12.4 billion also includes almost $2 billion for shovel-ready affordable housing. So, very much at the state level, we are laser focused on expanding housing affordability and, continuing to innovate and identify, partnerships that lead us to producing housing and services more quickly to this very important population. And so with that, I would like to now turn this over to my colleague from San Diego, Rick Gentry.
Thank you, Lourdes. Appreciate it. And I very much appreciate that last photo you showed was of San Diego. That is a nice transition. So thank you so very much. And let me begin by giving my thanks, especially to Governor Newsom, and Lourdes, also to you, to Secretary Castro Ramirez, for the creation and implementation of the Homekey program. And I appreciate the opportunity today to share with you all the details about the San Diego Housing Commission's recent purchase of 2 hotel properties. And let me begin by giving a reference to our website, where there's a lot of information about these 2 properties for anyone who would like to look them up. And that is www.sdhc.org, or just Google the San Diego Housing Commission. Go to the website, go to our real estate section, then go to the homelessness part of that, and you get a lot of additional information. I will point out that the Homekey program funding was an essential source to make this program work. It was not the only source of funding we used, but it was a catalyst that made it happen. And we converted these properties into permanent housing for individuals who experienced homelessness. Next slide, please. The Housing Commission began exploring the possibility of acquiring hotel properties soon after the onset of the COVID-19 pandemic. And actually, as Lourdes pointed out, the Project Roomkey program launched in March of last year. And we began looking at taking advantage of that for actual purchase a month later in April of last year. And the Housing Commission actually set aside enough money that would cover the rent for up to 300 units for up to 2 years to allow us to do a lease purchase option on the existing Roomkey program, hoping that the state would come up with a purchase program. And they did, frankly, quicker than we thought they would. And Lourdes, thank you for that timely action there. That allowed us to get started a good bit earlier than you might have thought. So in April of last year, we went out to look for properties, did a request for proposal, and also went out with licensed real estate brokers and to look for properties. And we came back in with 20 properties by May of last year. We summarily rejected 10 of those for not being, for having quality issues. And then another 10 we did full inspections on and full due diligence, and we wound up rejecting those as well. So what we figured out was that of the first 20 properties that we looked at, if we were looking at properties for immediate use, none of them fit the bill, which produced a lot of consternation, as you might imagine, here in San Diego. And what helped us in this process was that the Housing Commission had extensive experience in the past in doing purchase acquisitions of hotels with extensive redevelopment work on those hotels. In addition, one of them in particular, I'll refer you to on our website, the Hotel Churchill in downtown San Diego, which was built in 1913, which we rehabbed into a homeless facility primarily for use by homeless vets. That's just a gorgeous facility and fits in the need very well for San Diego. We had also had extensive experience in funding rehab hotels owned by third-party partners, by private sector players. But those we figured we didn't have time to do, given the nature of the problem with the pandemic. And the fact that the city had already housed over 1,000 formerly homeless folks in the convention center, and that there would be a need for an immediate facility for those folks as well. So after rejecting the first 20 properties, we went out a second time in June, again, before the program was announced by the state, but when we saw it coming. And this time we came up with 9 properties that we took a look at, and of those, we selected 2. So these 2 properties I'm going to mention to you were after looking at 29 and rejecting a full 27. And these 2 are Hotel Circle South in Central San Diego, and one off Kearny Mesa Road in the northwestern part of the city, both of whom were former Marriott Residence Inns. And what we decided to do in this whole process that lasted from April till about through June was to narrow our search to 2 basic qualities for our properties. One is that we wanted properties in good physical condition. We did not have the time to do a full rehab here, although we knew how to do that. There just wasn't the time for spend a year or 2 figuring out what to do and then doing it. We needed immediate occupancy in good quality properties. The second was we wanted properties that would have the proper physical configuration, and I'll get to that in a minute. For example, we decided to look for extended stay hotels with ensuite kitchens and full-size living areas. Next slide, please. And so what we decided we wanted to do was come up with properties that would be mini apartment complexes, if you would. And since there were hotels that would have sufficient meeting space to provide services for this particular customer base. And I would ask you just a moment to take a look at this timeline, if you would, beginning after we had already decided which properties to do. We were ready to take to the Board of Commissioners of the Housing Commission in early August, these 2 hotels. And these hotels were not inexpensive. The property we acquired in San Diego's Mission Valley area, we paid $67 million for. And the second property in Kearny Mesa neighborhood, we purchased for some $39.5 million. And you can do the math. They cost some money, but they were much less expensive than full apartment complex acquisition would have been, particularly in turnkey shape and ready to go. And what we're able to do, because we had those decisions made of what to do and what we wanted to see the end result, we were able to go to the Board of Commissioners in early August with a ready application. We were then heard back from the state, from Lourdes's people, by the end of August that the state had reserved some $27.7 million initially. We then took it to our board to authorize the purchase of the 2 hotels, assuming that additional money was coming, which it did just 3 days later. And then we took it to the city council in October to finalize the local deal. And I'll point out to you, I can deal with this in particular if anyone wants that. I actually work for 2 different boards here in San Diego. The city council sits as the housing authority, and the housing commission is a subordinate body that gives advice to the housing authority, the city council, on items that we do. So we got it through both boards, and then we actually completed the purchase in November of 2020, so that residents could begin moving in December. Next
Rick,
slide, please.
if
Yes.
I could ask you to just speed up, I think we'll be
I will
willing
do.
to provide the deck, which has details on the two projects,
Will
but we
do,
are
will
running a
do.
little long. So if I could
Will
just
do.
ask you to wrap up. Thank you.
Absolutely. Well, let's go to slide 14 then. Let's go quickly through a couple of slides. Again, I got ahead of my slides here too. Let's go to the next slide. We also knew that in order to provide the services, we need to provide the behavioral services as well. So we contracted with two different homelessness provider organizations that also do permanent supportive housing. One is People Assisting Homeless Path, the San Diego branch of that LA-based organization, to do one property, and Father Joe's Villages, which is a locally based organization, to do the other, to provide those self-services you see listed there on the right. And could we go to the next slide, please? This is just some photos of these properties. I'll point out that the properties are some 332 rental units that actually house some 393 people, because a number of the units are 2 bedrooms. And we figured out a way to do double occupancy in most of those. You add to that the services, and we've got what are essentially 2 full service mini apartment complexes serving almost 400 people that will be in use for the Housing Commission for decades to come. I'll point out that the financing, the principal financing was debt. We received a $50 million loan from Chase Bank, which is secured for a project-based voucher supplied by the Housing Commission. The money from the state and Project Homekey was $37.7 million. The rest monies that came from the Housing Commission and the city to make it work. And again, I'll be glad to respond to questions at the end of the presentation. Thank you, Mary. And Mary, will you turn it over to the next speaker?
Yes,
please?
absolutely. Thank you. And now I've had a couple of questions from people asking if they were only going to hear about California, and the answer is absolutely no. We're now going to turn it over to the team of Representative Pam Marsh and Megan Loeb, representing the program in Oregon, which you'll find has some similarities, but also some important differences from Project Homekey. Representative Marsh.
Thank you so much, Mary. We are glad to be here and bring you greetings from the much smaller but equally enthusiastic state above California, that is Oregon. I am going to share our origin story, and then Megan Loeb from Oregon Community Foundation will talk about the execution of our project. From my perspective, my involvement in Project Turnkey really started in July of last year. My community is in Southern Oregon, and I had been involved with advocates since the beginning of the pandemic to really look at how we were going to provide services to our homeless population. We know it's hard enough to shelter in place when you have a brick and mortar house, but when your home is a tent and a sleeping bag in the greenway, how do you possibly take that on? So because of some innovative partnerships, including frankly entities who had often never worked together before, we were able to provide some very good services to our homeless population, and ones that I were proud of. We allowed people to shelter in place. We took them food, we took them medical services. And it was all pretty stable until we got to July, because quite frankly, we thought in those early months of the pandemic that we'd be done with this by September or October. And then midsummer, we looked ahead and realized the pandemic was not going away. And our traditional shelter services, which quite frankly consist of, if you are lucky, the opportunity to throw a mat on the church basement floor from 10 at night till 7 in the morning, had never been best practices, and were certainly not a good, certainly didn't represent a good approach in a public health pandemic. So we looked around my community and said, we need to buy a hotel. We had had some experience during the pandemic with short-term housing of people in hotels, and we'd seen how much the model worked, how just giving people their own space and some stability and a place to put their stuff allowed them to deal with some of the issues that were right in front of them, and then move on to much more stable situations after they'd left those conditions. So we started looking at a motel, and at that point, I lifted my head out of Southern Oregon and looked across the state and talked to colleagues and realized that our experience in our community was really paralleled in communities across the state where people had been doing their best to help our homeless folks survive the pandemic. But the pandemic had also required us to ask and answer questions that we've been able to avoid in the past. If you tell someone they need to pick up and move their camp, now we realized we really had to have an answer for them about where they could go. So communities across the state were looking for help. And at that point, I hooked up with the League of Cities, the Association of Oregon Counties, the Oregon Community Foundation, and we founded what we called, and you will see some similarity in names here, Project Turnkey. And we decided that our goal was really to try to get funding to purchase 18 to 20 facilities with the goal of establishing 1,000 rooms across the state for immediate shelter purposes and potentially for long-term low-income housing. So we put that project together. We started pitching it in legislative forums. And then in September, we had horrific wildfires hit our state. My own community in my little district lost 2,500 homes as a result of those wildfires, displacing thousands of people. And in a community that was already housing starved, our housing crisis just exacerbated. So we had not only the pandemic and the homeless issue, we also had many displaced wildfire survivors. And at that point, we went to the Oregon Emergency Board, and in a couple of different allocations, were able to get $65 million to put into Project Turnkey, with the goal of investing about $30 million of that pot into counties that had been affected by wildfire, specifically to help house wildfire survivors, and another $35 million for the balance of the state to take care of our traditional homeless population. And then with the money in hand and the vision established, we turned the whole project over to Megan Loeb and Oregon Community Foundation, which took responsibility for implementation. And before I hand it over to Megan, let me just note, we could not have done this without the Oregon Community Foundation. Government is good for many things, and government provided the money, but we had many issues to deal with in the pandemic, and we could not have unrolled this program as we did within the Oregon Housing and Community Services Agency. So I think that's one of the lessons learned, is the opportunity to contract with a partner who you can depend upon to do the vetting, to bring the communities together, to make sure that these are good, solid projects, was really a critical element of our success. And with that, Megan, take it away.
Thank you, Representative Marsh. I really appreciate those kind words. And as Representative Marsh indicated, this project really was born out of urgency. That $65 million allocation came to the Oregon Community Foundation, not because we are a real estate developer, but because we are a trusted grant administrator and we have deep relationships in the state with a lot of nonprofit partners and service providers. When it came to us, we worked very quickly with our state partners, especially our state housing agency, to ensure that we were creating a competitive application process that aligned with state strategic priorities. We also very quickly assembled an advisory committee of stakeholders around the state who had deep expertise in this area and lived experience, and centered racial equity in our process. That was primary to us. Our committee has provided all of the review and recommendations for these grant awards so far. It's important to note, and I think all of you are aware, that no region wants to overbuild its shelter infrastructure. Shelter is only ever a gateway to permanent housing. And one strategic advantage of this model is that it allows both that immediate shelter and the longer term housing in one single investment. Our state cost per unit is hovering right around $80,000, and that makes this an incredibly cost-effective model. So over the past 6 months, we have successfully deployed all $65 million through this initiative with a diverse geographic reach across the state of Oregon. It represents 17 projects and 800 new units of shelter and housing in our state. Each of these projects was subject to due diligence, not just on the operations side, but also on the real estate side, to make sure they were good investments of state funds. Funds were awarded primarily for the acquisition of properties, although we also provided funds for renovation, especially as it related to safety and accessibility concerns for properties. And then a small number of organizations, especially those that were very rural or newer culturally specific groups, received operating funds for capacity as well. We have learned a lot through this process, and I'll touch on just a few of the successes that were, that we were really fortunate to have. The first is that this focus was on community-centered applications. This allowed the model to be both hyperlocal and scalable statewide. Each applicant came to us with their own priority population they proposed to serve and a property that they felt would suit that population, not just in the short term, but would have use in the long term as well. The second is our advisory committee. I always say that they show up with alacrity, a real cheerful readiness for the work that they are doing. And it is true. They have offered incredible expertise. They've shared lived experience. They have truly centered equity at the heart of every decision made. And it's been such an incredible part of the success of this model. And then the third piece is that we have retained some real estate consultants who have been phenomenal and have really helped us to condense a very complex real estate transaction into a 6 to 8 week window. They've helped to oversee all of the due diligence related to appraisals and inspections, land use, every hurdle to really make sure that we're being good stewards of these state funds and that these are assets that these communities want to own, not just in the short term, but also in the long term. We've run into a lot of challenges as well, and I'll just touch on one of those, and that is zoning and land use, which I'm sure is no surprise to many of you. We had a lot of applicants who were hindered by land use regulations, lengthy local jurisdiction processes, and they were very fortunate that midway through our legislative session this year, there was a bill that passed that allowed for zoning for hotel and motel conversion. And that ultimately allowed a number of our projects to move through our process and be awarded for grants. I just want to note, and this is echoing what Secretary Castro Ramirez said as well, this really has been a collaborative effort. No one sector is going to solve this problem. This has been collaborative from the inception of the concept all the way through implementation and now beyond as we look to see how as a state we can continue to support these projects. And I just want to acknowledge that it truly has been a public-private partnership of the very best kind. And then finally, I want to end by focusing on the people in the walls of these buildings. We've talked so much about the technical details, but I really want to go back to and focus on and center the people at the heart of the work that we are doing. We're hearing so much about the stabilizing role of hotels and motels. We've known for a long time that that's true for families. We've known it's true for the LGBTQ community. But what we're learning is that hotels also serve a really valuable role for people experiencing chronic homelessness, that the ability to have a door that locks, a key, a stable address to deliver medications or job applications is really impressive in its longer term outcomes. People have a chance to decompress, to stabilize, and then to navigate toward permanent housing. So I just want to acknowledge that one really important piece of dignity in this model. We are so glad to have been able to be a helpful partner to the state of Oregon in this work. It's really been an honor. And with that, I think I'm passing it over to Michael Monty with the Champlain Housing Trust.
Thanks very much. And if you went from California to Oregon, you thought that was small, I could say that we still have, what's his name from that TV show, still greeting people at the door at all of our motels and hotels. So Champlain Housing Trust serves a population of a couple 100,000 folks in Northwest Vermont, goes from Vermont urban to very rural. And when we get the slideshow up, is the slideshow up? Can people see that? No. I'm waiting for my tech folks to bring it up quickly. Henry. And there we go. Excellent. Thank you so much. So CHC operates for 35 plus years in Northwest Vermont. We serve about 7,000 people in 2,400 apartments and shared equity homes. We own a variety of real estate SROs to community facilities, tax credits, co-ops, a range of different types of properties. More than 50% of our light tech properties are less than 30% of median income, and 20% of our residents are formerly homeless. So we really focus on very low income folks. Next slide, please. And since 2013, we have purchased 6 motels, hotels, and are about to purchase 2 more. We operate 2 motels as providing shelter overflow. 1 is for medical respite, and several have been converted for other uses: permanent housing, permanent supportive housing, and non-congregate shelters. Next slide. First motel we purchased was in 2013, a 59-room motel, and this was essentially that we thought we could provide a better motel, better shelter service with better results and better services for the individuals who were going through the motel system at the time. We purchased the motel at a fairly standard price, was the appraised price, and entered into contracts with the state of Vermont, the medical center, hospital, and other service providers for folks to come into the motel. We operate it as a motel. People come for a day or for a week, and we have social work staff connected both with service providers and with ourselves. Overall, it breaks even. And we're going to come back to this motel at the end of the slideshow, but essentially, it's been a key part of the homeless shelter services program in Vermont and Northwest Vermont. Next slide. Second one was this was 32 rooms, and we converted this into 20 apartments. Essentially, you see the total development cost was essentially $180,000. We were able to get it up and running in a year. We didn't actually purchase this. We're actually leasing this as a master lease. The lease really is a fancy way of financing the program, and they're giving the owner cash flow. Local Housing Authority provides all of the subsidies. This is for the people who live here have been living on their own in the woods in Vermont for the last 5 to 10 years. That's who this is serving. So imagine Vermont. Imagine Vermont's pretty cold. That's who this is very much a high touch kind of program, and we have somebody there funded through the hospital health services every day for 7 days a week. Next slide. Next one was actually working with the hospital. Hospital gave us all the money we needed for this particular conversion. And again, 5 permanently supportive apartments, but 3 apartments which were going to be used for medical respite, both long-term and short-term. Again, the cost for this was a couple hundred thousand dollars per apartment, fairly small place. And it really does really well in terms of serving the people who we're working with. In a $6 million grant, both purchased the property, renovated the property, and is in an account that serves to support the operating part of the medical respite part. Next slide. I'm going quickly, so you know. Okay. The next thing, and then we hit the pandemic. So we have now a history of sort of understanding how to buy property and to convert. So we bring that to the pandemic. And with that, in the context of this, the state of Vermont really did a great job. I think nationally, 25% of homeless folks became sick with COVID. In Vermont, it was less than 1%. No one died who was homeless from COVID. It really was about the effort that we did in terms of using motel systems throughout the state of Vermont, but also in terms of the work that was done in terms of the conversion of some of the additional work that happened using corona relief funds. And once again, a fairly quick timetable. We advocated for this in the legislature. It was passed by the legislature. The funds became available in May, and we were up and running within the 6 or 7 months. Next slide. First one is the first thing we did was buy another motel serving simply COVID isolation and quarantine. Anybody who was homeless who needed to be isolated, quarantined, came to this motel. During COVID, we hired about 22 staff altogether. While folks were releasing staff, we were hiring people in order to staff these efforts and other efforts. Again, we'll come back to this. You can see that the price per night is a fairly low rate, and overall it becomes very cost effective for the state of Vermont to give us the money to capitalize the property and to support the operations through the COVID relief funds, some state funds, but really a lot of FEMA funds as well. Next slide. So the first funds that we used with the COVID relief funds, we took a suite motel, 113 room motel, turned into 68 apartments. Total development cost was under $190,000. No debt, all corona relief funded. These are the average apartment here is 800 square feet. Development time, we started in July and we were up and running and had people in there starting in November. So it was a fairly quick conversion. And again, we have out of this enough money to pay for a full-time social worker on site plus an intern to support the people. These are all folks who came out of homelessness directly into this motel. So this is permanent affordable housing right now for us. Next slide. The next project with Corona Relief Funds was creating a better shelter for women who are suffering domestic violence. And a lot of the people in the motel system who are homeless are domestic violence victims. We have been working with this particular group, Steps to End Domestic Violence, now for a few years, looking at a better program for them, not a shelter, but in fact, something that was small apartments. These are not transitional apartments. This is a shelter. But instead of going into a shelter system, they go into a small apartment with their families and are able to sort of, I think, have better level of services. This is transforming really for this particular shelter. We count this as 21 suites that are available now, available to folks. And again, total development time was 3 months on this one. Next slide. Operating costs are paid for by the state of Vermont. So now out of ARPA funds, we advocated right away and very quickly for additional funds and are using $94 million to provide housing and increase shelter capacity throughout the state. We were right there very quickly, sort of on a daily basis in Zoom, talking to our legislatures and talking to leaders within the state. And this is sort of the effort that is coming out of the ARPA funds for the next year. And we're engaged now in purchasing 2 more motels. So next slide, I'll show you those. So the 2 additional motels and some other things, and you got to remember some of the slides I showed you. I did go quickly, but we're going to buy a 99-room suite hotel, turning into 78 apartments. And this one, it's the development cost is a little higher, but we're using ARPA VHCB as a Vermont Housing Conservation Board that it provides funds for affordable housing and a mix of 4% tax credits, no debt. Again, money cash flow will go into services. Another 58-room motel will replace the original 213, that motel we bought in 2013. We're replacing that with a new motel, and then we're going to convert the existing motel right away into 20 apartments. And then going to also, over the next year and a half, create another 80 or so apartments from that development, from that land parcel that we own. As we buy another motel, we're essentially replacing the motel and repurposing the existing motel. And in addition, the COVID motel that we did purchase, we're converting that into 20 apartments as soon as the state feels it doesn't need it any longer. And that should be in the next 6 to 8 months. So the next slide. Here are the lessons. Rapid development time, lower development costs. That is really the key here. They're doors, nothing but doors. You take 2 small rooms, you close one door, you open up a door between them, you have a kitchen and you have a bedroom. And that's how we sort of looked at these. We have willing sellers. We don't have to call anybody anymore. They're calling us. We're a smaller community, but so they know where we are. We hired 2 brokers who are looking for properties on a regular basis and opening up conversations with folks. Cautious buyers. We have passed many motels. We've gone and said, no, we can't buy that. It's simply not going to work for us. For everything we buy, we have a plan A, and then we have a plan B, and then we have a plan C. In other words, we know what the next development opportunity might be if we're using it short term for one use and how to change it to another use, or if we want to create larger number of units. The first motel we bought in 2013 was a motel. Now we're going to get 100 apartments out of that property 7 years later. So we're thinking long term. Building codes are an issue right off. Electrical issues, energy and level of rehab work has to be considered, and sometimes we do pass because we can't do it. Neighbor and municipal relations. I know all the chiefs of police, in all the communities, and we are regularly having conversations with the local communities to make sure that they're in support of what we're doing. Close coordination with our existing service providers. And again, staffing is important for motels. Front desk is important. All of our property managers are former social workers, or at least have done service work, so that we make sure that when they're going into these properties to manage them as property managers, they actually know what people issues or needs are and can work through that. And again, security becomes a very important issue in all the properties that we are doing. Homeless folks, as a population of folks, are homeless for a range of reasons. Sometimes those things show up in their when they are in their regular apartments, and we need to make sure that the rest of our staff is safe, and that the community itself is safe as well. I'm done. Mary, thank you very much.
Thank you very much, Michael, and all of the panelists. You just heard 3 stories of creativity, collaboration, commitment, and results, and all of them importantly grounded in local communities. I know Megan really hit that home, but it's so true of all 3 of the programs that this would not have happened had the programs not been designed to work with decisions being driven at the local level. All of you as listeners around the country now face the challenge and opportunity to plan in your states and communities for how you will mobilize federal resources to create housing for people who are homeless. The American Relief Plan, passed by Congress in March, provides both the $5 billion in the home ARP program, for which regulations will be coming out in the fall. And also, many states are looking at the possibility of using state and local discretionary funds from that act that can be mobilized for these purposes. So we hope that we've planted some ideas with you as you begin your planning efforts. Our goal for this webinar, staged jointly by the National Housing Conference and the National Alliance to End Homelessness, is to give you the facts about this new strategy for converting non-residential buildings to like hotels to permanent housing. But I want to say it doesn't have to be limited to hotels. Other buildings like nursing homes, dormitories, even convents are possibilities that you might want to consider. And in just a minute, I'm going to ask Secretary Ramirez and also perhaps Michael about some of the other strategies that they used regarding modular and mobile homes in rural areas. This solution is not a panacea, but these results suggest that it warrants a serious review as you craft your overall strategy. With leadership, some targeted regulatory relief, plus resources, this strategy can produce housing very quickly and at a cost no higher than, and in most cases, quite a bit lower than new construction. But quickly is really the issue. Within a few weeks, the National Alliance is going to be publishing detailed case studies of the programs that you've learned about today. All of the people on the screen have worked with me over the last several months to bring these case studies together. They're going to get into more detail about key successes, plus barriers and lessons learned. And they'll provide links to program materials that you might consider as you map your strategy in your state, county, or city. We'll make sure that all of you who attended today's webinar receive a link to when the case studies are available. Also in July, the National Housing Conference has graciously agreed to host another webinar where we're going to get down and roll up our sleeves and look at more projects at the project level. So for those of you who were intrigued by the program level discussions we had today, but really want to know how you do this at the project level, I hope you'll watch for the announcement of those webinars. So now we'll proceed to the Q&A section. And I do want to ask Secretary Castro Ramirez, before you need to leave us, if you would talk a little bit about some of those rural strategies. I know you worked a lot with tribes. I know that there are some single family solutions that you employed. Could you talk a little bit about those?
Yes, thank you, Mary. Thank you. And I think it's a very important point, to make that while we focus very much on hotels and motels, of the 94 projects that were funded within the state of California, 74 or really 78% were motels and hotels. We did have, a diverse set of housing types that included single family scattered homes. In Oakland, for example, we were able to fund single family homes, 15 single family homes. And to your point, we also work very closely with tribes in the state, and we're able to provide funding to 3 different tribes, to be able to develop housing in, sort of modular housing. So this is a program that need not just be wedded to hotels and motels. We are also closely looking at expanding to commercial buildings. We did have one project in Santa Barbara that was an office building that was converted into permanent housing. So as we look at Homekey 2.0, and given where we're at, coming out of this pandemic, we're very mindful that we need to expand the housing types, and we're also very confident that there is inventory and capacity, as I said earlier, to be able to make this happen. And just the last thing that I will mention, Mary, is we have a very detailed report that was shared with the audience. It's a legislative report that details the projects, also the strategies around engaging smaller rural communities and the importance of geographic equity.
And also, Secretary, I want to mention, you mentioned it in one of your slides, but the way that the program was set up to actually reserve allocations of funds so that it provided the ability for big and sophisticated organizations like RICS to get in early and move quickly on properties. For those communities that maybe had never interacted with the state agency before, we're able to get technical assistance and help them in locating and an appropriate property, and then being able to still get a commitment for those dollars later in the process. So I think that's an important thing as people are thinking about program design. Michael, do you want to add any comments about rural strategies from a very rural state of Vermont?
Yeah, so we do a mobile home lending program. So because we realize that in fact a large number of folks are using mobile homes as a source of housing, and it works very well for many folks. Manufactured homes is really the right term. I do want to say that we have worked on buying some dormitories, and we're about to create 60 apartments in 2 or 3 buildings from a college locally. And so we have looked at sort of other buildings. I don't think it's just motels. Motels are simpler because there it is. There's a door, and it's starting at least to set up for all the utilities you do need. But there are certainly lots of other properties out there for conversion.
Great. And Megan, any additional, yours is a very rural program as well. Any additional thoughts on rural strategies?
I think one of the key learnings that we had in this process around rural Oregon was that, sorry, my My dog's excited about the UPS truck at the at this front door here. One of the things that we learned in rural Oregon was that deep listening and community engagement and conversations were very important. That was something that took time, and we were really finding ourselves in a paradox where we were trying to address the urgency of need. We had 6 months to deploy $65 million thoughtfully, and at the same time, we also really wanted to allow for equity and for community and voices and community engagement in the process. And so that paradox was really challenging at times, and most notably in our rural communities. We did find that the Fair Housing Council of Oregon was really helpful in facilitating conversations, bringing communities together, really finding common language and an understanding of the need for these types of properties in every community in Oregon, not just in our urban centers.
Thank you, Megan. And Rick, I'm going to throw you what might be the last question here, and that is, we have lots of questions from the audience about whether there were challenges that we've all experienced in affordable housing about NIMBY, not in my backyard, if there were concerns of neighboring properties about these properties converting to permanent housing for people who had been homeless. And what were some of the strategies that worked for you in addressing those issues?
Well, there were certainly challenges as real estate. There were challenges, a number of them. But the two properties, one in particular was surrounded by a lot of other developments, other hotels, condominiums, and was interestingly close to the San Diego River, which has a number of homelessness encampments, which are particularly troublesome here. And so what we did when the neighbors objected, we reached out, we convened a number of neighborhood meetings, which were chaired by the PATH folks who are the program operators who operate the property. And basically we agreed to be a good neighbor. We agreed to help the neighbors reach out to the more problematic parts of the homelessness problem here in San Diego. And we agreed that there'd be common objectives, there'd be periodic meetings. If there were problems, we'd take care of them. And we would branch out beyond our property to engage the city, both service providers and law enforcement, to allay their concerns. And we've been in operation now about 6 months. And it's worked very well so far.
Great. Thank you, Rick. And I know the secretary needs to leave us at the bottom of the hour. So thank you very much. And Megan, please give our thanks to Representative Marsh, who had to step away as well. I have been notified that some of the other panelists will be able to stay for a few more minutes. So if those of you who are on the call want to stay on, we'll answer questions for about another 10 minutes. Michael, do you want to comment on the whole issue of working with neighbors to have them understand how these properties would fit in their community?
It's interesting for us. Our first motel that we purchased was challenged by the local town after sort of a change in leadership there. We started being welcomed, and eventually the leadership changed and we had to essentially go through a zoning fight. So we had to actually prove that we were in fact serving the public. The town indicated that thought we were not serving the public when it came to serving homeless folks. And we said, no, homeless people are the public as well, just a different clientele than, let's say, the Park Plaza in Midtown Manhattan. And so we won that fight. And since then, the local towns, I think, have said, okay, let's cooperate with CHC, because in fact, we want something that was seen, I think, from the county perspective as being kind of landmark. You can't just sort of get in the way of sort of creating housing for affordable housing, or even for homeless folks especially. But often enough, when we move into some of the motels we are taking over, they have been motels that have been sort of supporting and working with homeless folks already. And so we're welcomed as a better level of management, a stronger level of management, a stronger level of support. You know, we're providing services, we're constantly in contact with the police, and if there is an issue, and we are providing security and support of sort of making sure that it is a safe place. Most one of our places, the 68 apartment places, call it Susan's Place. The tenants call it Susan's Palace because it's so much better than where they were. And the police chief says, yeah, he does get calls there more often than he would in the typical development, but much, much better in terms of communication coordination. So that's the key, really. It's being available and really making sure that you're constantly in contact with folks and addressing the issues in a legitimate way. You know, if you're getting pushed back because you're serving people who are homeless or low income, you got to fight that fight. But if you're getting pushed back because there's some issues around how tenants might be acting within the neighborhood, then you got to work with those tenants and say, you can't do that. That's the difference.
Very good. Thank you, Michael. And I know there's a question I'd like to put out there about operating costs on this project. And Rick, there's a question that I think needs to be corrected a little bit, and that is, I think it wasn't maybe clear that the state, in fact, did provide some operating subsidies that were then supplemented by some of the private dollars. I know your model in San Diego is a little bit different, but could you talk just generally about what the commitment of the state was to making sure that these properties could operate for a period of time?
We had to prove to the state, and the state was utterly correct in requiring this, that we can make these properties operate for the long term. And whether we were going to go for basic low scale, small apartment complex with minimal services, or like the San Diego did, where we've got basically 2 large apartment complexes that'll be available for us for decades to come. Either way, we had to show that we can make them work. And my advice would be to look at it as real estate. You've got to include the real estate factor in addition to the social services factor to make it work, or else you're going to have some real problems. And I'll tell you how not to do it. We received San Diego received a call right after we got some publicity on these 2 properties from another entity in the state not represented on this call. Basically, the entity said, well, we just purchased a hotel. How do we operate it now? How do we pay for it? No. What you've got to do is not the field of dreams approach, not build it and they'll come and it'll all work out hunky-dory. You've got to run your numbers, and you've got to make sure you've got the money to make it work. And the state money for us was a catalyst. We could not have done it without the state money, but it was nowhere near everything we needed. So we were able to get debt on this property, and we were able to, because we could project base our own vouchers on it. That's what made it work as well. So you got to look at all your funding options and put together a real estate pro forma that will work in the long term. And operating costs are going to vary, whether it's an expensive location like coastal California or less so in other parts of the country. That's going to vary. But you got to make it work on your own terms and your own economy and your own sources and uses, or else you're going to dig yourself a deep hole and you're going to have real problems going forward.
And Megan, I know that your collaborative committee, that long list of names you showed us, really worried a lot about the ongoing operations. So could you comment on 1 or 2 things about the Oregon model with regard to operating costs?
Yes, absolutely. It was a requirement of our applicants that they needed to provide an operating budget and be able to show sustainability in this property long term. And the way that was possible, especially in a state where shelter is only ever funded year to year or biennium to biennium, was really those strong relationships and partnerships with their local continuum of care, with their community action agency if they weren't one, partnerships with their housing authority to be able to secure vouchers for longer term funding streams and revenue. And then also, of course, very importantly, connections to our state housing agency, Oregon Community Housing Services. They were an incredible partner through this process and really did work with us on a shared information to understand how we could really braid a lot of different funding sources together. One important thing we heard from communities time and time again was that the creation of this infrastructure, this asset, would allow them cost savings long term. So having a property debt-free was really a starting point to redeploying other funds that they might have utilized in the past to purchase hotel rooms or vouchers, for short stays for people. We're able to, those dollars could be freed up and redeployed for other purposes. So what we're seeing is some reshuffling of funds, in addition to a lot of connections at the state and local level to provide a really comprehensive braided funding source for each of these properties.
Thank you, Megan, for that explanation. And I do want to use your explanation to talk about the resources that are available going forward. I really encourage all organizations that providing this type of housing with sufficient support for the ongoing operations really will be a collaborative effort, whether it's in your county, your city, or a statewide program like this. And it really does take that collaboration with your continuums of care that have access to money through the Emergency Shelter Grant Program and others. There are additional dollars in the ARP program that are in different buckets for some short-term housing vouchers that may not be your long-term solution, but may get you to the point where you can bring a permanent funding package together. There was one question in the chat before I hand it over to Luke that I do want to answer, and that is, there will be a case study along with the 3 states you heard from today. There will be one case study that focuses on Hennepin County, which is where the city of Minneapolis is located, where in fact at a county level, they took action to acquire 4 hotels, which on a scale of population was actually equivalent to the level of impact that they could have in their county as Oregon and California had. So I do encourage you to look at that local case study as well. Thank you so much. And Luke, I think you're going to bring us home.
Thank you very much, Mary. And again, this is Luke Villalobos. I'm the Director of Policy and Research at National Housing Conference. And I just want to say in closing, thank you all for attending this afternoon. And a special thank you to the panelists for the great content. We can tell by the number of attendees, as well as the number of folks who registered, that this is a needed topic. And there is a lot of interest in how to use federal funds, local funds, state funds for this purpose. And so I think this webinar going over the programmatic pieces of these hotel motel conversions around the country, I think is needed, and as evidenced by folks that showed up. And I will just say that the video recording of the webinar will be shared in advance for all the folks that registered, as well as the presentations from all panelists. And I think we will send the emails or some contact information for the organization. So if people want to reach out directly to the organizations on the webinar, if you have direct questions for them, you would have an opportunity to get specific questions answered. And I just want to say one last thing that we are, Mary previewed this earlier on in the webinar, we are planning to have a subsequent or part 2 of this webinar of the hotel motel conversions. We will be looking at the project level details, real estate transactions, and also looking at long-term servicing of these affordable housing units. And so we will have service providers as well as developers who really kind of get into the nuts and bolts of how to make this work. And so we encourage you all to sign up for that. We will be sending, you'll see it on our social media, and you'll get emails from us about part 2 mid-July. We're looking at July 15 right now. So please stay tuned for that. And just want to thank everyone again for being here, and good luck. And we'll hopefully see you guys soon.